Hello students, I'll show today a specific tube which is used for a specific surgical procedure in the abdomen. Just to identify it, it will be kept as a kept in Viva, in MCQs, in Oxy also it will be kept. So identify this very commonly used specific tube actually. So what this instrument tube is, look at that. Here it is a horizontal like this it is. See that? It's like this, or inwardly like this. It is like this. This is the horizontal part. This is the vertical part, longitudinal part. So this it is Kehrs T tube. So it is specifically used for CBD to place, usually after removing the CBD stone. So CBD stones are primary and secondary. Primary CBD stones occur commonly in the common bile duct. Secondary CBD stones are stones which slip from the gallbladder. Gallstones slip across the duct and cause the biliary colic, cholangitis, and it requires ideally current situation wise you have to do ERCP after confirming CT by CCT abdomen. Then you have to do ERCP, of course LFT, altered LFT is observed. Prothrombin time INR has to be corrected if it is altered, and ERCP has to be done. You have to remove the CBD stone, secondary CBD stone, then place a stent for 3 to 6 weeks. And after that, immediately next day, surgeon can do the laparoscopic cholecystectomy, so they remove the gallbladder with the stone. ERCP stent is removed usually in 3 to 6 weeks, usually in 3 weeks. Retrieval of the ERCP stent is very easy. And this is Kehrs tube is different, where mainly if ERCP is not available or ERCP is failed, very large stone, then after removal of the gallbladder, after through an open subcostal approach, and you open the CBD called as choledochotomy, and where usually CBD diameter will be more than 7 millimeter, it's dilated because of the obstruction. Then once you open the vertical is common bile duct called as choledochotomy, then using D-Jardine choledochothomy forceps remove the CBD stone, then place this Kehrs T tube. You have to place this T tube across the CBD, it comes out as a drain. So it drains the CBD selectively so that it prevents the spillage, and you have to suture the CBD using 30 Vicryl or 30 PDS interrupted sutures, and so that it takes time to heal. Until then, to prevent the leak into the peritoneal cavity and biliary peritonitis, this tube is placed, and this tube is usually kept for 10 to 14 days until it forms a track. It is made up of latex, so it causes immense reaction. So further leak or contamination in the peritoneal cavity by the bile is prevented. So before removal in 2 weeks, you have to do a T tube cholangiogram and confirm that there is no CBD further stones or blockage, where the free flow of dye into the duodenum. After that, with the traction, gently you remove the Kehrs T tube. So this is called Kehrs T tube. Remember parts, and it's radio opaque. Remember, so you can take an X-ray and confirm where exactly T tube is. You can inject a dye to the vertical limb and do a T tube post-operative T tube cholangiogram, which is usually done to confirm and before removal of the T tube as such. So features are already told. It's a radio opaque tube placed over the common bile duct, especially for the secondary CBD stone. Primary CBD stone, there is a pathological defect in the physiological mechanism of the common bile duct. Such a situation where multiple, often large, extensive across the biliary system, both right and left hepatic ducts. You have to remove the gallbladder, open the CBD, retrieve all stones, give a good wash, then do a Roux-en-Y choledocho or hepatico-jejunostomy. That is the ideal treatment rather than remove the stone and place a T tube. Choledocho-duodenostomy or choledocho-jejunostomy, or otherwise often called as hepatico-jejunostomy, which is more ideal name. That is the treatment for primary CBD stone. Secondary, ERCP, then laparoscopic cholecystectomy is ideal. If ERCP is failed, then open choledochotomy, then remove stone, place a T tube, then do of course, after removal of the gallbladder. Currently, of course, through laparoscopy, both removal of the gallbladder and CBD choledochotomy and removal of the stone and placing a T tube can be done laparoscopically if surgeons are skilled for that procedure. Safely, laparoscopically also, this can be done, placing the Kehrs T tube. So it is kept for 10 to 14 days, remember. So these are the different uses which I already told how long it is kept before removal. T tube is must, and you should see the dye across. Another Kehrs tube, when it is kept in the exam, Kehrs sign also they will ask. That is the sign which is seen in the clinic injury with the clinic hematoma, where hematoma occurs above the spleen, between the spleen and the diaphragm. So diaphragm nerve get irritated. Patient develops the referred pain into the left shoulder. There is Kehrs sign. This is the Kehrs T-tube. Students, please go through my SRB clinical method and surgery with the video, proper video methods of examination, and detailed examination is there in this book, beautifully written with the proper illustrations and photos. Actually, my SRB's Manual of Surgery, current edition, details everything about all subjects with the quotations, with the MCQs and case scenarios. All topics, including specialties, are covered. Please go through that. And my detailed 2-volume operative surgery book, test and atlas, every procedure, minor to ultra major procedures are detailed properly. My small atlas with the skill how to use a tissue approximation, how to use needle with the proper appropriate lecture videos correspondingly for that. Please go through that. My DigiNow lectures about the all surgical topics, small to everything covered, CBME syllabus. With the specialties briefly, instruments, operative surgery, clinical examination, specimens, everything as far as our CBM syllabus is considered. So go through this lecture, subscribe for a year so that both UGs and PGs, this is very, very helpful. So student, I understood this specific Kehrs tube very well. Thank you very much.